Hello and welcome to The Print. Most Indians take far less calcium than recommended. A lot of people also take calcium supplements to meet their daily calcium requirements. Now, a consensus statement by Endocrine Society of India has urged clinicians to rethink the way they prescribe calcium supplements. It also says that calcium supplements should ideally be only taken whenever there is a special requirement from the body, which is, for example, in events during pregnancy, lactation, or menopause, or even in certain bone related conditions. Otherwise, the requirement of calcium should completely be met through food. Now, to understand what prompted these recommendations, why experts are saying that clinicians should reconsider the way they prescribe calcium supplements to the public, and why everyone with a bone pain does not need calcium tablets, we have Dr. Ambrish Mithal, Chairman and Head of Endocrinology and Diabetes at Max Healthcare in Delhi. He's one of the authors of the recommendations and the consensus statement. Thank you so much for joining us, sir. Welcome to The Print. So the first thing that I want to understand is what made Endocrine Society of India to bring up these recommendations and this statement at this point? And is it because doctors were over-prescribing or irrationally prescribing calcium supplements?
No, it's not just that. I think this calcium is a very important part of our prescription, especially for those who deal with metabolic bone disease, who deal with bone disorders, who deal with osteoporosis, vitamin D deficiency. Their calcium is a very important part of the prescription. However, there was confusion, and there is confusion, about who should be prescribed calcium, how much should be prescribed, which calcium should be prescribed, and so this is particularly important in the context of menopause and osteoporosis because there are strategies worldwide where everyone should get calcium in their postmenopausal age and all that. So keeping that in mind and keeping in mind the fact that there is a lower calcium intake than recommended in India in the general population, although it varies a lot between state to state and east to west and north to south. That's why it was thought important that at least we have some guidance about calcium supplements, when they are required, how much should be used, and which is a good sort of salt that should be recommended. So that is what prompted, because of confusion. Sometimes, as you were saying, there's overprescription. Everyone the patient goes to writes their own calcium. The patient is seeing 3 doctors, ends up taking so much extra calcium. Sometimes it's because anything to do with bone, people overprescribe. Like the amounts prescribed are much higher than what is recommended. Sometimes those who clearly need it are not prescribed calcium. So just to make sure that our doctors are prescribing calcium to help them choose in the right way, in the right amount, neither excess nor lower than what is required. That's the idea.
Also, for our viewers, if you could explain really, the effects of calcium deficiency, because there's a lot of it in India now, and how widespread it is, if we can quantify that.
So I think it's calcium is a very important molecule for the body. Of course, the traditional role of calcium is in bone health. The calcium is what builds our bone. Now, it's a basic mineral there. So that everyone understands, you need calcium for bones. Even your grandmother knew that when you're growing, you need to take milk to get calcium for your bones. So that's one part. But calcium has roles in other things. It has roles in blood clotting. It has roles in the cardiovascular system. It has a role in neuronal transmission, nerve transmission. So calcium is not just a bone sort of mineral. So yes, so therefore ensuring adequate calcium intakes is important, which is why worldwide every society, every authority, government has their guidelines. So in India, the ICMR and IN have guidelines for calcium intake. So that we are sort of, we're not competent to revise those or anything. That's the job of the NIN and the ICMR. We are just saying to achieve those intakes, what needs to be done. So the truth is that one of the papers that we wrote based on the last family health survey, I think the average calcium intake was around 429 milligrams per day or something, which is almost half of what it should be. So, so it's obvious that there is calcium deficiency in large proportions of Indians, except in certain pockets, Punjab, Haryana, and maybe certain parts of the south. By and large, we are not consuming enough calcium, and particularly in the east, the milk intake and calcium intake is very poor. Now, remember, this all is linked directly to dairy product intake. And one line that I'll say here before we move to the next question is that India is the largest producer of milk in the world. Milk production has been one of India's huge success stories. For more than 20-25 years, milk production is going up. We are doing jolly well there. But we somehow it is not translating into equitable calcium intakes across the board.
So one of the top recommendations is that meeting calcium requirements entirely through food, unless you have certain conditions. That's what is being recommended. My question is, how realistic is that recommendation or that guidance? Also, generally, what is stopping people from meeting that requirement? We have dairy abundant, right? Why are people not consuming enough calcium?
That's a very good question, and that's a question we ask also many times. But there are some factors that are there. So the first is that it's not impossible to achieve for an average person, a young person. It's not difficult to achieve a reasonable calcium intake. The primary source is dairy. I know people will get up say, no, this kind of laddu has that, this kind of calcium, it's present in so many seeds. But the amounts that actually add up, when you add up the amounts, they don't really mean that much. For anyone to have a good calcium intake, you need to have definite consumption of dairy products. It could be milk, it could be dahi, it could be paneer, but you need products which are dairy, from dairy. So if you're completely off dairy, it'll be very, very hard for you to achieve adequate calcium intakes. Now, why do people not achieve it? Well, the milk is fairly sort of widely available, milk products, there's no shortage, but I think there's still a bit of economics involved there. That is one part. I don't think that, like, there will be sections of society where milk is not considered all the time. The other is that as Indians grow, then very often Indians develop lactose intolerance, and that means that they can't tolerate the lactose sugar in the milk, and therefore they develop a lot of discomfort, abdominal discomfort after having milk. So there again, they would maybe avoid milk for. Then there are all these things that people are worried about, weight, and people are worried about inflammatory diets, and there is a whole school of thought that says that milk products should not be used and milk is all harmful and dairy is all should be abandoned. People go to the extent of saying humans are the only ones who take milk of other animals and all kinds of things. So that is all. Everyone has a right to their opinion, but the fact is that the science doesn't hold out. The science at the moment says that we need calcium, we need protein. That's a separate story. And to get that calcium, the best source is dairy. So if someone is doing it simply because their friends are doing it or because they heard about it or they read on Instagram, not a great idea. If someone is doing it because they can't tolerate it, that's completely understandable. So if you can't achieve, so for example, a 200 ml cup of milk will have 250 milligram of calcium. So if you're having a dahi with both your meals and maybe a cup of milk or a larger cup of milk, glass of milk, you're okay. You may have it as cereal, as this thing, whatever. But the fact is that if you're not having milk at all or very little, maybe only in tea or coffee or something, it'll be impossible to achieve your calcium requirements unless you take supplements. Now, the other thing sometimes people say is that, it's not dairy, I take soya milk, I take almond milk and other. Now, soya milk is a good example, which is a very good source of protein. But unless it is fortified with calcium, it's not great in calcium. So in the West, at least, all the soya milk you get is calcium fortified. So it becomes protein and calcium both. So you have to add calcium to it. So same way, for whatever milk you're using, you need to make sure that it has enough calcium if you're not having dairy. So this is the reason. Number one, uh, some of it is economic reasons, but a lot of it is also people who are intolerant genuinely, and there is a lot of it which is based on, uh, possibly advice that tells you not to have any dairy at all.
All right. Another strong recommendation is actually against the use of or routine use of calcitriol. So, for our users, if you can explain what is really the issue with available calcium supplements in the market, and why does this clinical guidance caution against using calcium supplements in general?
So, random use of calcium supplements is not recommended. A very simple test used to be in the old days that you drop the calcium tablet into a glass of lukewarm water and gently stir it. And if it doesn't dissolve in half an hour, then it's really not going to get absorbed anyway. So, I mean, just saying, these were what we were doing earlier. So, yes, so calcium tablets, randomly using them is also not good. As I said, you have to assess the calcium intake. The other thing in India is that you don't get calcium tablets. Every calcium tablet is combined with 3, 4 other things, which sometimes you don't understand what it is. Very often patients and sometimes even doctors have no idea. They just prescribe it thinking it's calcium, but it has many other things added. And you mentioned calcitriol. What is calcitriol? Calcium needs vitamin D for its absorption. So vitamin D, small amounts of vitamin D are often part of every calcium tablet. Vitamin D as in cholecalciferol. Cholecalciferol. What in India pharmaceuticals do sometimes, they add calcitriol, which is an activated form of vitamin D, calcitriol, to a calcium tablet, which I think actually is not a recommended fixed drug combination at all. It's a fixed drug combination if you ask me. Because if you're taking something thinking that it's calcium, but it also has calcitriol, which is active vitamin D, then you're exposing yourself to the risk of high calcium levels, all kinds of problems, renal stones, all those things can happen. So, simple calcium with some amount of vitamin D, native vitamin D, cholecalciferol, is what we recommend. That's why, because there are so many preparations with calcitriol, and it always bothers endocrinologists, see why is there calcitriol here? And patient is taking 4 pills without knowing what they're taking. That's why we caution calcitriol is not basic, not native vitamin D.
But how do the consumers identify what they are actually having?
Just you should. I mean, it's difficult, but you have to just read calcitriol. I mean, I think we should be clamping down on combinations of calcium and calcitriol. If you ask me honestly.
It's mentioned in the wrapper that you.
Yeah. So calcium and cholecalciferol is okay, but calcium and calcitriol is a problem, and I don't see many of those combinations outside India. So I think someone should look into this.
Okay. Another thing is coming to myths, the common myths around calcium supplementation. In your clinical practice, what are the most common myths that you come across regarding calcium supplements?
So, one is that anyone who comes with any bone problem, it may be arthritis, it may be, whatever, it may be even a fracture, requires a lot of calcium for the bones to build back. No, we only require the amount of calcium that we require. So having too much calcium is not going to help us. So that is one myth that sometimes in their hurry, doctors or surgeons prescribe, or patients, friends or family, and say, are you not having calcium? How will you recover? They take extra calcium. So extra calcium is not okay, but adequate calcium is important. So correct dosing is important. The other thing is patients who clearly require calcium because of their osteoporosis and their own treatment will sometimes not take calcium because somebody will tell them, oh, you'll get a heart attack, it'll deposit in your heart, or somebody will tell them you get a renal stone, So I think that when you're prescribed a calcium, you should ask your doctor that, to weigh the risks and benefits for you and then prescribe it, and not randomly that everyone shouldn't be just taking it. So the idea was to give some judicious sort of guidance so that people don't go overboard with it, but yet those who require it should be able to access it.
All right. Now coming to the problem at large. Do you think that deficiency of calcium should be looked at as seriously as, let's say, iron deficiency, which is widespread in India, or even protein for that matter, even if it's a different question? But is it that serious?
So I think that when you look at deficiency, we don't really call it deficiency per se, but low intakes of calcium. You have to look at it in combination with vitamin D, because without vitamin D, calcium is useless anyway. So if you look at vitamin D calcium deficiency in India, it is a significant problem. Vitamin D deficiency is quite common, in particular in urban areas, in particular in winter. So well established numerous studies. Okay. Now, if you're deficient in calcium and along with that you generally have low D levels because you don't go out in the sun, or there is too much pollution, the rays get scattered, or you're always well covered when you go out. If you're deficient in vitamin D as well as not taking enough calcium, then clearly your bone health will be compromised. It will be particularly compromised in children. In children in Delhi, it's been shown that more than half of them may not have adequate vitamin D. And let's say maybe half of them also don't have enough calcium. I mean, I don't have the data about that. But so the fact is then the bone growth will not happen the way it should. The bone bank, the bone strength will not happen. And these people will be prone to osteoporosis later. They will not build big bones. So I think it is a significant problem. We need to correct the calcium intakes, but it has to go along with correcting vitamin D deficiency to have any impact. You just correct the calcium, don't correct the D, it won't get absorbed.
Okay. All right. I think these are the questions I had for you, sir. Thank you so much for joining the print. That was all from me. Thank you so much for watching the print. I am Sneha Richhariya with my colleague Sakiba Khan on camera. You were watching the print. Thanks.